80 and older. Other senior age groups will follow in the months ahead, finishing with people 60 in July. So why isn't Ontario ready to go now? Retired General Rick Hillier is chair of Ontario's COVID-19 Vaccine Distribution Task Force. Hi, General Hillier. Good to see you. Thank you for making the time.
Vashti, my pleasure.
The last time we spoke on Family Day, in fact, just 9 days ago, you said Ontarians over the age of 80 in the general population would be able to be vaccinated the first week of March. Today, though, you announced even just the online portal to try and book an appointment won't be up and running until 2 weeks after that, on March 15th. How is that acceptable to Ontarians?
Well, if we had the vaccines to bring them forward exactly to the 1st of March, Vashti, I would understand it being an issue and controversial and unacceptable, but we simply don't have the vaccines until we received a relatively big Moderna shipment the middle of March, and that's what we're aiming for. That's going to help us to be able to move the group of 80-year-olds and above further into March instead of doing them in April. So, yeah, we would have loved to have been in the first week of March, and if I gave that impression, I apologize for it. We would have loved to have been in the first week of March. We do not have the vaccines to do it.
With respect, General, you didn't just give the impression, you were very specific about it. You said it would happen in the beginning of March. And there are other provinces where we are seeing those vaccinations begin, let's say, for example, in Alberta and Quebec early next week. They were given the same supply per capita that Ontario was. The distribution was based on the province's population. So why are they ahead of us?
Because their prioritization must be slightly different, Vashti. And we prioritize very carefully those in most vulnerable circumstances. That's been a focus on long-term care homes, retirement homes, high-risk retirement homes, elder care facilities, healthcare professionals, patient-facing particularly, where we focus, and of course our First Nations and Indigenous adults, particularly in the communities across the north. So therefore, we are where we are to be able to move the 80-year-olds forward, not as far forward as I want it. We actually think we can maybe push them further forward in the next weeks here, but the vaccines are the crucial part of it, Vashti.
And what do you mean by the vaccines? I want to be clear on this because the Premier of the province especially has faulted the federal government for the supply of vaccines. I acknowledge completely that supply was greatly hindered in the last 5 weeks. It is significantly ramping up. I'm looking, for example, at what Ontario is scheduled to get this week, 156,000 doses of Pfizer at 17,000 doses a day. At 7 days a week, that's 119,000 doses. That means 37,000 doses aren't being used even this week.
Vashti, that's correct. But here's what we're doing. We're at about 17,000 doses a day. We're ramping that up in the next several days after being shut down almost completely, not completely, but almost for almost a month without the vaccines. We're behind in all the programs. So we're starting up, moving them on, and we're ramping that number up. And we'll do that in the next several days here. So by the time the shipment comes in next week, we will have used the vaccines that we have available to us right now. But because of that drought, Vashti, we're behind in those second doses, and we want to catch those up. As you know, we extended the interval to 35 days. We were going through the long-term care homes and retirement homes now to get those second doses through. We're recommencing with the healthcare patients, the healthcare professionals who are patient-facing, and we need to give them the protection so they can carry on and do the care that we need them to do. And we're also focused on that First Nations. And then we are still, with all of that, we are still moving those over 80-year-old population forward into at least middle of March. And there may be some areas around the province where they'll have completed perhaps a few days sooner some of the other priorities and be able to start with a smaller number of 80-year-old plus earlier than the 15th of March.
You talk about ramping up, and again, with great respect, how is there still a problem with ramping up? Why is there still ramping up to do? Why in that glut, those 4 to 5 weeks where there was so little supply, why isn't Ontario ready to vaccinate with every single dose that comes in the second it gets in?
Vashti, we are. And so here's where we are. We're in a ponderous, somewhat awkward and somewhat clumsy phase right now, where we, like I said, we are taking vaccines to the people as opposed to the people coming to the vaccines and people coming to mass vaccination centers, because that's the most efficient way. But with those most vulnerable populations, that's what we have to do, and that's what we're doing. So that is a little slower. It is a little clumsier, but we're at it, and we're going to ramp up over this next couple of days and use what we have without question.
When you say you're going to ramp up, for example, by my calculations, next week between Moderna and Pfizer, Ontario is supposed to get 233,000 doses. All of those will be used up in that week. There will be none left over.
Some of the Moderna will be left over, Vashti, because we have to keep the Moderna. We have to keep the second dose with Moderna because of the separation in the shipments that come to Ontario. But those Pfizers we're going to use for sure, and we'll use half or more of the Moderna itself.
Do you understand Ontarians' frustration today, listening to you, listening to the Premier? Again, respectfully, they are watching I have a headline to my right now where Alberta is talking about how pharmacists and the plan for pharmacists to deliver these vaccines. Family doctors say they don't know how they're going to be involved. Pharmacies say they don't know how they're going to be involved. I know there is a localized process with public health units in place too, but for the average Ontarian to find out how they're going to get this vaccine, when they're going to get it, and who's going to give it to them, there are simply no answers right now.
Well, Vashti, that's not quite correct. I laid out this morning, we've done it a little bit before, said you're going to get a vaccine close to your home, where your postal code will indicate. You're going to get it either at a mass vaccination center close to your home, or you're going to get it in a pharmacy, or you may get it in a, what I would call a mini mass vaccination center that family doctors might come together with the public health unit in coordination with them to actually bring their patients in and more and run a vaccination clinic. So they know where they're going to get it. We've had a contract signed with the pharmacies. We're doing tabletop exercise with them. We've had numerous discussions of how we flow this. We're working through those things with the pharmacies. They are engaged. We will run a pilot project in the next several weeks with the pharmacies. So we'll actually start putting vaccines out through them. With the family care professionals, the family physicians, the doctors, you know, I can't talk to every single one in Ontario. What I would say to you is reach out to OMA. I've talked to the head of OMA. I've talked to a variety of other associations that represent those primary care professionals. Reached out to them. We've talked about what they can do and what their part is. We want them putting needles into the people of Ontario. They're not going to do it in their offices for quite a long while yet. The vaccines just don't lend themselves to that. But they can come in and become part of a mass vaccination system, and they can band together with the public health units, and they are doing that to become what they called SWAT teams going out to those long-term care homes or other populations. And they're actually doing that. To say that they don't know what they have to do is simply not correct.
But in the specific sense, it is, because you're talking in general terms, right? There will be mass vaccination sites. They will be involved in some capacity, though not in their own office. Well, what capacity? Where are those vaccination sites? At what time will they be open?
Well, Vashti, they are open as we need them and as the vaccine flow permits. We're going to have a capacity when we open them, when we have the vaccines to allow that, of 10,000 per public health unit across the province. That's over 300,000. We'll never get to that allocation of vaccines. So those mass vaccination centers are across the province of Ontario. You know, Toronto's announced where their 9 mass vaccination centers will go, and they will open them when the vaccines are available to permit them to do that. Others have done the same. York Public Health talked about they're going to have a mass vaccination center as a drive-through vaccination center at Canada's Wonderland. So all that knowledge is out there with the public health units and with us. And when you in the age brackets go to reserve your time in the line to get your needle, you will put in your HOIP card, your age, and you will put in your postal code. And then those vaccination centers close to you will pop up and give you the option of reserving an appointment to get your needle in one of those. You know, whether it's Shoppers Drug Market in Orleans on 10th Line, or whether it's Sir Wilfrid Laurier Mass Vaccination Center, or whether it is indeed the Metro Convention Center, it will pop up and allow you to book in it and book your second appointment at exactly the same time.
Okay, I'm sure a lot of Ontarians watching are anxious to get that news. General Hillier, I'm out of time. I'll leave it there. I do appreciate your time. Thank you.
No problem. Thank you.